Good morning, April.
Good morning.
How are you doing today?
I am well, thank you.
How's the conference going for you so far?
Wonderful. It's nice to see so many people that show up for the community.
Yeah, did you have some traffic? Some good conversation so far?
Yes, very nice, both with providers and networking with the vendors that are here as well.
Cool. So what organization are you with?
So I'm with Iowa Diabetes.
Oh, we need to talk about that now.
All right.
We need to talk about diabetes. So
sure.
first, okay, let's break it down.
Yeah.
What is diabetes? Because, when I grew up, it was called the sugars.
Okay.
That's what it was called.
I've not heard that
the
way.
sugars, right? So I
Okay.
just thought it had to do with sweets, but
Yep.
it really doesn't. It's not just that. So break it down. Give us some knowledge on what diabetes is.
All right, you're going to put me to the test now. So with diabetes can come from a multiple variety of factors. It can be genetic, passed from, generation to generation, but it can also come from lifestyle. So lifestyle is a big thing. The way that we eat, unfortunately, in America, not always the healthiest choices. Obesity, having different health conditions.
Okay.
There's a lot of different ways that someone can have diabetes.
And there are a lot of different types of diabetes too, right?
Correct. Yes.
So on a severity, so I've heard of type 1, type 2. What makes the severity different? Is it insulin? Is it what is it?
Yeah, you're on it.
Okay.
So with type 1 diabetics, they're insulin resistant. So they depend on insulin. So that's going to be the main thing that separates type 1 and type 2. Type 2 diabetics, their body over time becomes insulin resistant, but usually can be controlled with oral medications or more formal diabetic medications, and sometimes do need that insulin.
Okay. So tell us a little bit about Iowa Diabetes. What is the organization about? What are the services that are offered? What
Sure.
can we tell our viewers about it?
Yeah, so our mission is to reach 1 million lives before 2027.
And how much are you at now?
Well, that's a secret.
Okay.
But, there's a wide variety of the way that we're trying to reach lives through things like outreach events. We have a lot of services that are in place with our social media. As far as services with Iowa Diabetes, so we're a diabetes specialty clinic. Our sole focus is diabetes. We have a wonderful team that is from our endocrinologist to providers, to diabetes education specialist, pharmacy team, just a great team that knows their stuff. Apart from being a specialty clinic with diabetes, we also do research. So, of course, the medications that we take now, they need to be studied, they need to be developed, and need to know interactions and different things. So we do a lot of diabetes studies, but we also do one big thing. If you've heard of Ozempic or Monjaro, we've got some different obesity studies, both for those with diabetes, but also those without diabetes. Fatty liver studies, just a variety of different study opportunities as well.
So why did you decide to be a part of the organization? What is your passion behind the topic of diabetes?
Yeah, it's definitely a need. There's a lot of people that shy away from getting their health checked. Don't manage their health as well as they should, or aren't getting the right services where they're at now. So, of course, not to shame any primary healthcare doctors, but it's different when a provider has a range of knowledge but isn't specialized. So my personal passion was just to get people on that right journey and on that right path to be able to control and focus on their diabetes.
Do you have any stories of individuals who have found your resources, your knowledge, your wisdom, your services beneficial to them where they're like, I am so glad you all exist because you saved my life?
Oh, yes, yes. Like if you would go onto our website or you would look us up, the testimonies speak for themselves.
Okay.
People that are involved in research have lifestyle, huge changes that are so grateful. A lot of the times we also do, to qualify people for studies, we do different labs. Sometimes in doing different labs, show them something they didn't know that they have. So we've actually been able to help people that have underlying health conditions get the help that they need. So there's just a variety of different testimonies, and yeah, people are definitely thankful and wonder where we've been. So
I can see that. I can see that because
Yeah.
diabetes is one of those, just like high blood pressure,
Yeah.
one of those medical conditions that is just raging. It's a high priority medical condition. So how can people stay connected with Iowa Diabetes? What's the best way for people to find out more information and find out about the wonderful services you're providing in the community?
Yeah, for sure. So they can definitely go to iowadiabetes.com, find out some different information about our clinic, research, what services we offer, because we also offer like medical nutrition therapy, ways to help deal with diabetes on a daily basis, social media. So, of course, just check out Iowa Diabetes on Facebook, giving us a call. So we can definitely be reached at 515-329-5690.
I love that you had that number right in the flesh.
Oh, yeah. So you can speak with one of our specialty navigators there that really strive to not only hear you and listen to you, but you can be calling in for one thing and they are ready. Their wheels are turning, knowing what services we have that can then help you. So we're also located at 4201 Corporate Drive.
Okay.
So if people are familiar with West Des Moines area where like Whole Foods is, we're right there. So we have a brand new building. On the side of the building, it says Iowa Diabetes in big letters. So
Amazing, amazing. Well, April, thank you, number one, for all the work that you're doing in this space for diabetes. Again, I do have a connection to that because it runs in my family.
Yeah.
So I do have a connection for that. Thank you for coming to the My City, My Health and educating and being here and out in the community. And just thank you for sharing your own personal story and passion. We appreciate those as much as possible because it is amazing how everyone is doing something that they are passionate about or have a purpose for. So we love to hear those stories. And I hope you have a remainder of a conference that is wonderful and you are able to interact and meet even more people who will hopefully start to connect and partner with you in the future.
Awesome. Well, thank you so much. Appreciate it.
Thank you. Perfect.